Good afternoon, good morning, depending where you are in the world. And it's a great pleasure to welcome you to this event of the Portuguese presidency of the European Union, where we're going to be looking with a panel of great experts at the next steps in the European health data space, which we all know is a very exciting initiative of the European Union. And we've got some great people who are going to discuss it with us. And I will introduce them when we come to hear their presentations. And indeed, I will invite them to introduce themselves because they are, of course, the experts on themselves and on the European health data space, not me. However, it's a pleasure to welcome you. My name is Petra Wilson. I am Europeans Programs Manager of HIMSS. I also have a number of other roles. And I've been working for very many years, more than 25 years, in the field of European health data and how we can use European health data. We all know, of course, that data is the fuel or perhaps the oxygen of our healthcare systems. Without access to high quality, trusted and user-friendly data, we can't treat patients, we can't administrate healthcare systems, we can't develop the policy that we need to run healthcare systems, and we can't undertake the research to find new medicines or new treatment models to allow us to do our best for patients across the European Union and indeed across the world. Despite the fact that all member states accept that access to health data is very important, we don't have a level playing field across the European Union around access to health data. Most member states have a wide range of legacy systems that they need to accommodate in terms of using health data, whether that's things like access systems within hospitals or record systems. We don't have standardized electronic health records across the European Union. And in fact, in many countries, we don't even have standardized health record systems within a healthcare system. So it's not yet easy to facilitate the sharing of health data across the European Union as we need to. The European health data space is the cornerstone initiative of the EU digital health strategy, and it's really there to help build that common level playing field across the European Union to facilitate the use of data. And I'm going to begin with just one slide to remind us about what the European health data space is and the objectives that it seeks to achieve. And then I'm going to invite our panelists to comment. So if I could just invite our support to display that one slide. Thank you very much. So here on your screens, you can see the slide which depicts the European health data space as provided by the European Commission. And I'm grateful to the European Commission for this slide. It is indeed their slide. And it shows the four big pillars of what the European health data space seeks to achieve. And the first pillar, or often referred to as the first need, it seeks to facilitate the sharing of health data for healthcare. That means it seeks to address the problems of patients having limited control and access to their data, and the problem I've already mentioned of limited interoperability between healthcare providers. It also, as I've already mentioned, seeks to address the big challenge of using data, secondary use of data, for making policy and also for research purposes. It seeks to address the problem of the relatively low reuse of health data. There are many estimates of how much, what percentage of data actually is reused, but the point is it's not used as widely as it could be. And that's for many reasons, including the fact that it's difficult or cumbersome to access data and that digital infrastructures are still fragmented across the European Union. And one of the areas of that, of course, is also the governance of health data is not fully standardized across the European Union. In terms of actually making digital health services available across the European Union and building the single market for digital health services, we also have an uneven legislative framework, uneven issues on the quality assurance framework for data. And we still have many processes such as e-prescription, reimbursement for digital services, liability for digital services in the early stages of development. And then the other big issue, of course, is AI. AI needs data. AI is only ever as good as the data that you can use to build the AI systems. So if we want to advance in using AI to drive better, safer, more accessible, more resilient healthcare systems, we need to have the data available. So I just wanted to share this one slide to remind us all where we are with the European health data space. But that's also quite enough background from me. Thank you for sharing that slide. I'd now like to turn to our speakers, and we have 4 great speakers with us today. And I'm going to ask each speaker first to introduce themselves and their organization, and then begin by answering some questions around the European health data space. And we're going to begin with looking at the perspective of what Portugal is doing. And I'm going to begin now by asking Joaquim Cunha, who is the Executive Director of the Portuguese Health Cluster, to share a little bit about how you hope to leverage the European health data space, but also to introduce yourself and the Portuguese Health Cluster. Joaquim, over to you. Thank you very much.
Thank you. Thank you very much, Petra. It's a pleasure to be here with you all. It's a first class round table. My name, as you mentioned, is Joaquim Cunha. I am, as you also mentioned, the Executive Director of Health Cluster Portugal. Health Cluster Portugal is a national organization of the Portuguese health value chain, comprising almost 200 members, from universities to companies, including hospitals and clinics. We are one of the supporters of the joint declaration towards a European common data space in health, and we are deeply committed with its success and implementation. As you know, this joint declaration is led by ScanBalt, and we have here with us Jaanus Pikani. For us, it is completely clear that digitalization and data are the gateways for the new health that the world needs, where Europe can and should play a leading role. Entering in your question, I would say that the key words for leveraging this challenge are cooperation, collaboration. We have to join efforts between Europeans. We have to strengthen and enlarge a European networking of doers, setting up small but useful and effective projects, and simultaneously working and preparing some bigger ones. We have to balance these two realities. We need everybody. We need the politicians and the decision makers in Brussels, in Lisbon, our capital, but also in our town. We need the universities, the hospitals, and the companies. We need the scientists and the health professionals. We need the citizens, of course, the patients and their organizations and associations. We need all of them on board. And a conference like the one we are here today is a good way of gathering and engaging all different people, bringing the awareness of the subject. But we also need a vision and a strategy. And I could say that in humble position, of course, that we have it in Portugal. We in Health Cluster Portugal have just finished the design of what we have called a National Health Development Plan. We know where, we know how, and with whom we want to go. And I know that the same happens in the other European countries. So the challenge is to synchronize these instruments and the consequent action. And I think the cluster organization had proved to be an intelligent way to do it. So I think the networking of health clusters all over Europe could be a good movement to set up this big change that I think we need desperately. Thank you.
Thank you. That's really good, and I'm sure we're going to come back to your key, which is collaboration. I'd like to now talk to invite one of the representatives of the provider network in this, Fernando. I haven't practiced how to say your surname, which means I may make a mistake. Araújo? No, I'm not going to make a fool of myself trying to say a Portuguese name that I can't say. My fault for not practicing it before. Fernando, I'm going to invite you to talk about the role of the hospitals as one of the major provider sectors, both providing data to the European health data space, but also using the health data space, about your ambitions to leverage the European health data space. But do please start off by introducing yourself.
Thank you very much, Petra. My name is Fernando Araújo. I am the director of João University Hospital. I'm also professor of the medicine faculty of Porto. João Hospital is the biggest hospital in north region of Portugal with around 1,100 beds. Well, regarding your question, in terms of public and also private hospitals, we want to be part of an European health union. We hope that European citizens could be treated in any country of the Union without bureaucratic constraints or national pre-authorizations. And to do so, we need for sure to build an European health data space, where this health information could be available in a simple way to professionals and institutions around Europe, where we could use to enable the increase of knowledge, the advance of science, and search for the best medical options for patients. We hope that this European health data space could be used to promote health economy, to inform political decisions, and to reduce inappropriate spending by our institutions. We hope that the ease of access to the information will also allow us to do some personalization of medicine, to do health prevention, and also to allow us a better health literacy for European citizens. So for us, this project, this ambitious project, is one of the most symbolic for the European Union for us, because this could really enable Europeans to feel integrated into a political project that makes sense. Thank you.
Thank you very much. That's very, very thought-provoking. I would now like to turn to Jaanus Pikani. You're the president of the board of ScanBalt, and I'm sure you'll give us a few words about that in a moment. But I'd invite you to explore what's the role of the industry partners, large and small, but also the academic partners and all the people that you've sought to bring together in ScanBalt and who you've activated through the European Cluster Declaration. What do you, could you perhaps highlight some of the initiatives that you've tried to bring forward and where you would like to see the European health data space develop? Jaanus, over to you.
Thank you, Petra. Yes, it's now very honored to be here with this high membership of this panel. ScanBalt is a meta-cluster organization, like we like to call ourselves. We are around already for 20 years. It's regional. It's embracing countries around Baltic Sea and a little bit beyond, from Finland to Netherlands, bringing together different players, public, private, and research institutions in life sciences, healthcare, and bioeconomy. So yes, as we being a network, so we are looking very much to the further collaboration, and collaboration is possible when you have a common ground, and common ground means, as you said, data are one of the most important elements. So what we have organized last year is to bring together clusters around Europe to collect views from cluster members, from companies, big and small companies, to see what they are looking from this endeavor. And it's clear that the expectations are high. There is emphasized that there is a need for standardization and interoperability, which actually enables this cooperation, but also it has to be secured that the data privacy and the data security has to maintain on the highest possible level, so to follow the general data protection regulations of Europe and to be guided from this, but also to empower patients to share their data and to be able, and patients should be actually enabled to exercise their rights to open their data and to use the data charity, as we call it. Because it's not only the primary use of data for the sake of the patient's direct need, but also for the more wider actually goals for society to support further developments in research and to develop new services and products. So this has been in a nutshell what our members and the cluster representatives have articulated in a form of declaration what was overhanded to the German presidency last year.
Thank you, and I think we have to be particularly grateful to you for supporting that continuity from the German presidency into the Portuguese presidency, and I know it's not going to stop there because you're already looking at how you can further these initiatives as we move on through the presidency cycle into the next presidencies, and perhaps you might want to come back to that at the end when we look more about where we're going in the future. The cluster that you described brings together small and large players, and we're very privileged to have with us today Ricardo, representing one of the biggest actors in European health data use, but also usage. Roche, you're of course a very big user and creator of health data. Ricardo, perhaps you'd like to say a little bit about what your company is hoping for with the European health data space and how you would seek to leverage it, and of course to introduce yourself.
Thank you, Petra, and thank you for this opportunity of having Roche and myself here sharing our vision about this critical and very important initiative. So my name is Ricardo Encarnação. I am the country medical director for Roche Pharmaceuticals in Portugal. And so Roche is a 125-year-old global biotech company. We are pioneer in pharmaceuticals and also diagnostics. And above all, we are focusing on delivering advanced diagnosis and transformative medicines to patients worldwide. This, of course, contributes to advanced science. And we believe that this combined strength of pharmaceuticals and diagnosis under the same roof had made Roche a pioneer in personalized healthcare. And this, I believe it's one of the most important things for us when we look into this initiative. So we know that data is at the core of digital transformation and personalized healthcare. And you, Petra, and all the three other panelists also address this. But for that, we need also public and private sector actors to work together in a new and innovative way. Personalized healthcare requires high quality data from different and diverse set of sources. You mentioned as well in your introduction, digital health solutions, electronic health records, genomic data. And you also mentioned quite nicely that for artificial intelligence and machine learning, in order for them to be applied and for these technologies to be applied here, we need a very strong and quality data set. And this will also at the end improve clinical decision-making, treatment, and ultimately patient outcomes. So, but given this diversity and volume of health data that is required for personalized healthcare, a fundamental shift in mindset is required at the European level, moving away from a small number of large organizations controlling access to data to an ecosystem, a truly embedded ecosystem that data is shared from the broader patient perspective and patient benefit. On the other hand, and together with personalized healthcare comes another very important aspect for Roche, which is value-based healthcare. We need to use this as an opportunity to develop a robust data ecosystem with broad and inclusive governance, something that will allow an improved interoperability of health data, but also, and very importantly, to define quality data standards and mechanisms to ensure data management transparency, addressing, of course, the needed protection of data and privacy rights for the individuals. So I believe that for Roche, as a clinical development and diagnostic company, having a very robust and widely available data set in Europe is something that we see not only as very important, but as a need for patients across the continent and actually worldwide.
Thank you. And you just provided a beautiful segue there into the next issues that I'd like us all to look at, because we opened up by asking you from your perspectives how you want to leverage the European health data space. And I think you've all come up with some great issues here around the need for collaboration, around and Ricardo, I thank you particularly for calling out this idea that we need to have a mind shift towards an ecosystem thinking in healthcare. And we've also looked at the needs for greater patient empowerment. All of this, and you've all hinted at it, requires a change in thinking and a change of approach in how we look at health data politically as well. And I don't mean politically here in terms of member states politics or anything to do with party politics. I'm talking here about the regulatory and legislative framework that we're trying to build up, and that the European health data space is of course seeking to do. We have the baseline of the Data Governance Act, which creates the gateway for things like patient data donation. Fernando, you mentioned also this idea around patient data donation, and Jaanus, you did as well. And you've all mentioned one way or another the issues around privacy, fragmentation, interoperability, all of these issues. So I think what I'd really like to ask you now is to think about what it is that you would like the European Commission to address as it seeks to develop new legislation that addresses some of the challenges that we still have with the GDPR, how you would like the European Union to really help you in your initiatives move forward. And let me go back to asking Joaquim to start off with your perspectives around that legislation, whether it's GDPR or other legislation that you would like to see change and develop better to allow better use and reuse of data. Joaquim, over to you.
Thank you. Yes, I think we all agree that the challenge we have in front of us is a big one, and so we need all the strengths that it could be possible to unite. And to do that, we have to give the most possible awareness to the subject, bring it to the daylight, bring to the agendas. But we also know that we have an elephant in the middle of the room called GDPR, and we have to face the elephant, not fighting against him, but looking at this elephant as an opportunity, because we probably all of you will agree with me. In general, that it's it makes sense. The GDPR makes sense, but the problem is how to implement it. And there is a generalized problem in all countries. And if we have a global approach, an European approach, if we think Europe, perhaps we could have a global solution. Of course, taking in consideration all the particularities of each country, but as you know, Europe in a global perspective, it's a big player, and this could be a tremendous opportunity for our R&D institutions, for our universities, and of course for our companies, and in the end of the day for the patients, because all of this have in mind the patient. So I think this could be, and let me dream a little bit. This could be an interesting challenge for Europeans that could unite all of us a little bit more. This could be the challenge for the next years, because as we learned in the last year, health is in the center of our daily life, and it could be a nice and positive opportunity to bring all of us a little bit more together. Thank you.
Thank you very much. Thank you for inviting the elephant into the middle of the room. Let me turn now again to Fernando, looking more from the healthcare provider sector. What is the big challenge for you, the regulatory framework challenge that you would really seek the new legislation being developed by the European Commission to address?
Thank you. I agree with Joaquim, Cunha. Nowadays, for health institutions, these rules are so hard, so demanding, that put a lot of constraints. And at the end, I don't know if they really defend European citizens. So my most important area that the European Union should reflect and discuss is the governance and the rules to assess health data. We must find an equilibrium of protection of the information of citizens and simultaneously put an easier way to assess this health data in order to defend the European citizens. That's our main target for your work in future, for sure. Thank you.
Thank you very much. And Jaanus, I know that you, with your group, you've worked very closely at looking at the European health data space, and I'm sure you've been helping many of the partners also think about the responses that they are developing at the moment, because I would like to remind everybody that the consultation period on the European health data space legislation is still open. It's still open until the end of June, and I think it's really, really important for everybody to get as much information to the Commission as possible. But Jaanus, you have the platform now to underline your desires again for what you would want the legislative framework to look like. Please.
Thank you. We actually are collecting still the feedback from our partners and clusters, so it's still time for the deadline, so we are in a process. But what is a general understanding up to now, what we can say that in one hand, of course, the GDPR has some restrictive sort of features, but at the same time it secures also that people can feel themselves secure and comfortable to share the data. So from many of our partners, it is viewed as a security, and that's why we need to know and to see how it would be best implemented, and to develop additional tools to empower patients, because we have good examples. For example, we have an example from Estonia where people have possibility to control the data, but at the same time they can check in each time each inter-accounting act. So which means that we can always look who has been taking a look to your data, who has been using your data. And with this, if you have such transparency, and you have also possibility to enable the use of data or actually close your data for primary or secondary use, then it actually creates totally different situation where the GDPR is your ally, not an enemy. And but what we need to see how the GDPR would be best way to implement and to create the tools that enables for foremost patients, but also all stakeholders to take most advantage of this, because without the actually trust, nobody will actually agree to share the data, and this will make it impossible to the common data space to make operation. So we see that we have to use all existing best practices to bring them to the European level, which is actually will need some technical and regulatory additional developments.
Very good, thank you. I think we're beginning to get a very nice picture together here of what is needed. And Ricardo, I'm conscious that I'm asking you to speak after everybody else, which is not always the easiest, because I'm sure one of the first things you will want to say is that you agree with what's already been said. But thinking again from the, well, I'm putting words in your mouth, I'm sorry, maybe I shouldn't do that. But
no, feel free.
Speaking again from the perspective of one of the companies that's really doing a lot to drive change, not only at European level, but actually wider, because you are, of course, a global company, and we've heard the need already to think about even wider than the European Union. Where do you want first the EU to go in terms of building this legislative framework? But do you have dreams beyond the EU framework as well?
Yeah. First of all, Petra, I believe that after speaking after this high quality panel colleagues that I have here, it's quite a privilege, because then I could eventually just say that everything was already done and said, and I need to reinforce the comments from Professor Fernando Araújo and Jaanus when they mentioned the need for this framework, the governance framework for data access and use, and above all, this transparency piece I found really interesting, the example that Jaanus shared. Roche had already had the opportunity to provide feedback for the European Commission regarding this project. I would say that not repeating what my colleagues already said, I would focus eventually on three main aspects, apart from the cross-sectorial governance framework, that we believe are key, and they will have an impact outside Europe, like you mentioned. One is on the enabling side of this. We need definitely a framework that sets the interoperability and quality standards for data across Europe. Otherwise, we will get a very heterogeneous data pool that will be useless. But we need this framework to remain as well flexible enough to allow for specific implementation across projects and across countries. On the other hand, we need also a very strong and clear focus on competence development. The data space is highly complex. It's an ecosystem that we are not familiar with. We need to invest in skills and general data literacy. We need to ensure a common shared vocabulary specific to data that all stakeholders understand and are able to use. And for this, I believe that something that we could start immediately addressing is a robust program educating individuals on both risks and value of data sharing. This will be key for trust development and build. And the last one is we need a common European data space in very strategic and highly differentiated sectors. we need eventually a policy framework that facilitates public and private cooperation, like Joaquim mentioned at the beginning. And for this to work, we believe there is a need for an European entity that would drive European and member state efforts in the field, something around or something similar to an European Health Data Institute or agency that could serve as a center of excellence on data science and policy, and also provide technical support to member states, take responsibility on development of standards and help to resolve ethical questions above country, and above all, that could promote international alignment through collaboration with other initiatives. So this could easily go beyond Europe, and we do believe that this is a very important step that we cannot miss.
Thank you. That's a really very helpful way of summarizing issues. And actually, part of my job here today is to try to summarize things at the end. And you've made my job very easy, because you've all been so clear in what you see as the big opportunities and challenges for the European health data space. So we've got something like 10 minutes or so left, and I would like to turn to each of you and ask you to leave our audience with two issues. One, and you've already all hinted at this, is the wish that you have for the Commission, the one thing that you think they really need to do to move on to the next stage in the European health data space. But then I'm also going to be a bit hard on you, because I'm going to ask you also for your promise. What are you, in your capacities, whether that's as Portugal handing over to the next presidency, or as big industry, or as the convener of clusters, what are you going to do? What promise are you going to give to make sure that the European health data space actually isn't just a promise, is a reality, really can do what we need it to do? Because if one thing that COVID has taught us is that healthcare doesn't know borders. It doesn't know borders within Europe. It doesn't know borders across the world. And if we're going to build the sort of resilience that COVID has shown us our healthcare systems need, whether that's resilience to respond to a pandemic, or resilience to respond to demographic change and aging populations, or resilience to respond to the need to have greener healthcare systems, all of these things need to be addressed. And I don't believe, of course, that the European health data space can do all of that, but it can perhaps contribute. So I'm going to end by asking each of you to give us a wish and a promise. And let me go, actually, maybe perhaps, and I haven't warned you, so you're now going to wonder who I'm going to first, but perhaps, Jaanus, I can ask you to answer first in terms of the wish and the promise that you would like to make for the European health data space. Jaanus, to you.
Yes, as a representative of cluster network, of course, our first wish to the European Union institutions would be that we could actually move on this as quickly and as a major effort as possible, but also with continuous transparency and communication with stakeholders, because we feel that if we don't have continuous communication and dialogue with the stakeholders, then the end result can be not very operational, or not 100% operational. This is, of course, what we feel that European Commission is already doing, and we would very much like to see that this would continue to the same path. But what we can promise in the same token is that we have already, starting last year, this is bring together the stakeholders and continuously to consult with the stakeholders. As it was said, we started under the German EU presidency, now continuing with Portuguese partners and working to continuously bringing together and updating the views for the declaration. The declaration is not actually a fixed document, it's a dynamic document. And also we have started to cooperate with the next presidency countries like Slovenia and France. We have already started to make our plans for next 6 months and also for the first 6 months of 2020. So this is what we can actually promise, that we are in all means try to support this process.
Thank you very much. Fernando, perhaps I can turn to you next for your short wishes and promises. I think you're on mute.
Oh, yes, I'll be very short, because to make promises is a thing with a lot of responsibility. But beginning with wishes, I wish that we can build a true European Health Union, something that we could have the enthusiastic support of our citizens. That for me is the big wish I can have. In terms of promises, we can promise that the Portuguese public and private hospitals will have this area in the top of our priorities and will be for sure part of the solution, part of this big dream. Thank you.
Thank you very much. And Ricardo, I'm not going to ask you to go last this time. So your chance now to make your wishes and promises known.
Thank you, Petra. I do believe that this is a pivotal moment and we need to act to create this long-term benefit for all. So the wish is that we definitely need everyone on board. So I believe that the only wish we could have is to see the electronic health data space come to life, as we all discussed today, that it can be. What I can promise, and I'm sure that I can speak for all my colleagues around the world in Roche, is we will continue to do what we know best, to collaborate, focusing on science and with patients in our mind and patient benefit, and continuing to be the best version of ourselves. And for that, the European Commission and all the stakeholders can count on us.
Thank you. That's a big promise, but I'm sure, and having worked with your colleagues in the past as well, I'm sure that you will be key actors in living up to that promise, not only for yourselves as a company, but actually for the whole community. Joaquim, I'm turning to you last because you are, of course, very actively involved with the Portuguese presidency, which is now coming towards its close, and we've got a great conference to discuss many of the issues that you're going to be passing forward to the future presidencies. But what would you like to see what's your wish for the Commission on the EHDS, but also your promise? I'll leave the word to you.
It's easier the wish than the promise, but the wish is for sure that a common health policy could be an objective for the Commission and for the Europeans, and this could be a way of going deeper in the Union, because we need to get more and more united. Otherwise, Europe will not survive. In my opinion, we have to go deeper in the Union, and health could be a nice glue for this union. The promise is that Health Cluster Portugal will be committed in these subjects, in data and digitalization in health, because we truly believe that this is the way. The big challenges we have ahead on R&D, on management, and on healthcare could only be tackled if we use in an intelligent way data and digitalization. Thank you.
Thank you. Well, you've made my job very easy. I would like to thank each and every one of you for being so clear, also for taking the challenge and making promises at the end. But don't worry, nobody's actually going to come and hold the fire to your feet to make sure that you deliver on these, because the one thing that has come through so clearly is that all of these promises can only be achieved through collaboration. I would say there are three big words that have come through from these presentations for me, and they are collaboration, transparency, and trust. That's what we need to make this work. Those need practical solutions, things like interoperability, quality assurance. They also actually, and I thank you, Ricardo, for pointing out the need to build new skill sets and to really make sure that we have the capacity to use data, because we are missing, both in terms of everyday citizens' digital literacy skills through to the data scientists. But I do think the word that we take away, the one word that we take away from all this is collaboration. And that is what you four great speakers have all demonstrated, the willingness to collaborate to build the European health data space. For that, I would thank you very much. And to thank also my colleagues at SPMS and also from my colleagues in HIMSS and around the world for this lovely session. Thank you very much for your time. Thank you.
Thank you.
Thank you.
Thank you.
Bye-bye.
Bye-bye.
Bye. Bye-bye.
Thank you.
Bye.
Bye.
Thank
Thank
you.
you, Petra. Thank you, everybody.
Bye-bye.
Bye.
Bye.
Thank you.